Welcome back to Wellness Fixes the Pod. We had so many questions surrounding our episode with Sunina, who is an international board certified lactation consultant and the owner of It's More Than Milk. So she kindly agreed to do a bonus episode answering more specific questions on feeding, because a lot of questions that I got from new moms were a little bit more broad, and the ones from, like I said, the veteran moms, it was more specific. So thank you so much for coming on again.
Of course, I'm happy to do this.
Let's start with milk production questions. Is kind of how I phrased it, I guess, supply level. But one of the questions I got was, when will my supplies start to regulate? And I guess part 2 and 3, is it true that my body will start to make the milk more nutrient dense as the baby grows? So even if my supply stays the same, it is okay because it is more calorie/nutrient dense.
Yes. So that is a great question. So we talked a little bit about this on the longer episode, but typically your milk supply goes from endocrine driven and hormonally driven to baby driven around the 4 to 6 week mark. When this happens, all of the engorgement and the leaking and the breast fullness and heaviness, that eases up a bit. So that's a good thing. Some parents will feel like, oh my gosh, I'm not feeling like my breast is going to explode anymore. My supply must be down, but not necessarily. It's most likely just the milk volume regulation. And so I would say about the 4 to 6 week mark, if you're a new mom. But if you're a subsequent mom, if you've done this once or twice before, then it might happen a little bit sooner, potentially even as early as 3 weeks. And so it's important to remember that just because you're noticing a difference with the way that things are feeling with you physically, that doesn't necessarily mean there's a huge dip with your milk supply or anything like that. I'm going to say this a million times in this episode, but reach out to a lactation consultant or another breastfeeding support person just to make sure that that is what's happening and not anything else that could be affecting milk supply.
What about the nutrient density?
Yeah. Oh, that's a great. Okay. So what is wild and fascinating is, so the way that a parent's body works in conjunction with their baby, anytime that you put a baby to the breast, or for the exclusively pumping parents, if you kiss your baby's hands or their face or any of that, that your body is going to ingest pathogens that are with your baby. And so when your baby is directly at breast or chest and you're feeding them, their saliva gets absorbed by our bodies, and our bodies are able to custom make that milk for them. And it is ever changing and it is ever evolving. And a great example of this is when somebody in the house is sick. So I've heard anecdotally, and even in my own home, cases of entire families being wiped out by a cold or the flu or something like that. Everybody except for the exclusively breastfed baby. And that's because as the milk making parent is healing and as they're getting better, they're going to continue to pass on all of these antibodies and all of these nutrients to their baby to help them either avoid the illness altogether, or if baby gets sick, it's a much milder version than what the adults have. But I would say, as far as the nutrient density aspect of it, yes. So between 1 month and 6 months, when you typically start solid foods, a breastfed baby takes about 24 to 32 ounces in a full 24 hours. It is the milk that changes in consistency to meet the needs of the baby. It's very well established by about a month, and then it kind of keeps settling in further. And so yes, between 1 month and 6 months, your baby needs a certain amount of milk. It's just your milk that changes in caloric density, in nutrients. And then during this time too, baby gets more effective at feeding. So instead of taking 30 minutes or 45 minutes to feed, you might have a 2-month-old or even a 3-month-old that is done nursing on both sides in 10 to 15 minutes. And at first you're like, there's no way that this baby is getting what they need from me. But sometimes we'll do a weighed feeding, or they'll monitor diapers, or they'll notice those, I guess, non-scale victories, as they call it, where all of a sudden baby's diapers are really snug, or the clothes that fit them fine last week, they've, their little feet are stretching them out. So it's definitely one of those things where, yes, it's going to sound real silly and woo-woo, but it's like you have to trust that your body is going to make the milk that your baby needs, and that your baby is going to tell your body about the milk that it needs specific for that instant. And so it definitely takes a lot of trust in our bodies. But for the clients I work with that have had trouble with fertility, or if they had a long and difficult birth, or, maybe a bumpy start, there's a lot of doubt and anxiety kind of hanging out in the back of your head. So we talk a good bit about that in some of our visits too.
So what I'm understanding, I guess, is it's a little bit of a top down, bottom up approach, if that's a weird way to put it. But
yes,
the baby is stimulating the mom to know what to produce,
Mm-hmm.
but then also the mom might be exposed to certain things in the environment that feed back into the baby
Exactly.
positively. Okay.
That's
I
it.
had no, I'm learning so much. So I
Yeah.
had no idea for all of this.
It's so fascinating.
So, speaking of what actually reaches baby, I've had a lot of questions on the pump and dump theory, of course, with alcohol,
Mm-hmm.
but there were also a lot of moms who were struggling with UTIs or different things postpartum, and they were wondering specifically about like medications or what actually, whether it's alcohol, medication, or something else,
Yeah.
what actually reaches the baby in the breast milk, and when do we have to be concerned about what we're consuming?
That's a great question. So, when it comes to alcohol, caffeine, any food, it's important to remember that all of whatever you're consuming, even medication, it's going to be broken down by your body. It has to get metabolized and filtered, especially the alcohol, by your liver and your kidneys. And then it's going to go into your blood, and then it's going to go into your milk. So, a good rule of thumb around alcohol is if you feel safe enough to drive, it's safe enough to breastfeed. And so, I do have some clients that are like, okay, well, I'm going to wait 2 hours after my drink before I nurse or pump for baby. And I think that's totally fine. You can do that. The best time to have a drink would actually be while you're nursing or pumping because your body hasn't started to metabolize it and break it down quite yet. But as far as alcohol pumping and dumping is a myth, it's not really going to get the alcohol out of your system any faster. But say you went to a friend's bachelorette party and maybe you had a little bit too much to drink. I would still recommend pumping just to keep that milk flowing. But I'm also a weird hippie mom, so you don't have to dump the milk. You can mark it and you can put it into a milk bath. I wouldn't give it to your baby to consume, but you can use it for alternative reasons. Yeah.
I love it. I didn't even think about alternate because I feel like a lot of people, pump and dump. It's
Exactly.
like, okay, but hang on.
Yeah.
There might be other things
You don't have to
use
dump it.
for.
Your body
Totally.
worked hard to make that milk, you know?
Totally.
Yeah.
What about medications or different things like that?
Yeah. In general, most medications that you took during pregnancy are also safe for lactation. Now, there are definitely some medications that are contraindicated for lactation. Some of them are for mental health. Some of them are for high blood pressure and postpartum hypertension and things like that. But in general, if you let your physician know that you are breastfeeding, they should be able to offer you a medicine that is compatible with breastfeeding. Yes, there is a little bit of whatever medication you take that is going to pass through your milk to baby. And depending on what the medication is, sometimes you have to do almost like a risk benefit analysis. Is it worth the risk of me taking this medication to help me function as a mom and as a human versus do I not take it and then everything will be perfect for baby, but I'll be a mess. So sometimes you have to sit down with your care provider, even with a lactation consultant, and be like, I don't know what to do. And so also on that note, thankfully, there are great resources, which I'll make sure to send you, but there are a couple websites that you can check. One is called Latch, and it is through the National Institutes of Health. So you just put in the name of the medication and it pops up all of this information. It's not going to tell you take it or don't take it, but it'll be like, this is the half-life. These are the possible effects on lactation. These are the possible effects on baby. It'll also suggest some alternatives if it's, maybe not so great for newborn babies or something like that. And then at that point, you will be an empowered patient and you can go to your physician and say, hey, I looked up that antibiotic that you prescribed to me and it seems like it might do a number on me, but also on my baby. Could we do this one instead?
Yeah.
And so there are definitely resources. That's one of them. E-Lactancia is another one, and that also has resources in Spanish, which is helpful. And then there's a place out at Texas Tech called the Infant Risk Center, and I have that number programmed in my phone because if I'm ever at a visit and I can't find the answer, that's really nice because you can call them. I think it's like 8 to 3, Monday through Friday, and a live human will answer, and they will go over all of that same information with you. But again, they won't tell you yes to take it or no not take it, but they can at least help you make a more educated decision.
I'm all about that. Just like trusted resources.
Yes.
For
Evidence-based trusted resources.
Exactly. Because like we mentioned in the first one, where comparison, you're comparing all of these things and all of these different journeys for different people.
Exactly.
And having someone like you to help, having these resources to go to is just like super duper helpful. So this is more of a personal question, but how would you know if something like alcohol or medication or something like that is affecting baby? What might the baby show, either pee and poop or behaviorally, that might indicate, oh, hang on, maybe I need to go get this looked at a little bit more?
Exactly. So with alcohol, to be completely honest with you, the parent would be dealing with alcohol poisoning long before we would see that. And really the risk of alcohol is not through the milk to baby, but it's more that whoever is drinking is going to be so incapacitated that they fall asleep on a couch or they fall asleep on a glider, just in a really unsafe position. And that can have some really dire outcomes. So that's regarding alcohol. But with medications, what you're going to want to look for is things like, is your baby sleeping a lot more than they normally are? Are they not sleeping as much? Are they more irritable and fussy? Or if they're having a lot of bowel movements, if they're having a lot of poop diapers, is that poop looking really strange? Is it not the normal consistency that it is? Do they seem like their belly hurts or they're bloated or just, not feeling so great? So these are all definitely signs that, yes, something that you're consuming is passing through to baby.
So how do you know if a baby has a good latch? And I guess along the same lines, is nipple confusion a real thing?
Yes, those are great questions. So when it comes to latching, obviously we don't want to feel pain. Pain is a sign that something is not going right with latch. Usually it's that maybe baby doesn't have a big enough mouthful of breast tissue. But I would say ways to know that your baby has a good latch is that, one, it's not painful. Two, what you're feeling is a gentle tugging from deep within your breast and it's very rhythmic. And the other way too is when your baby comes off the breast, even if you're not feeling pain, sometimes we can notice a change in your nipple color or nipple shape. And so it's one of those things where if you notice that your nipple is pinched when it comes out of baby's mouth, or it's kind of lipstick shaped, or it has a compression stripe through it, these are all signs that for whatever reason, baby didn't have a good latch. And then also if your nipple is blanched, the areola looks bruised, any of those things, those are signs of not a great latch. And really to make sure that your baby is latching well. I don't know if you've ever heard of the sandwich or the burger analogy. Okay, so when we go to eat a tall burger or a tall sandwich, I'm doing hand motions in case you can't see me. You're going to compress the sandwich in the direction of your lips, and then you're going to bring it to your chin and your lower lip first. And so that's what we want to do with breastfeeding as well. So we're going to want to shape our breast tissue in the direction of baby's lips. So if baby's lips are, let's say, vertical to your nipple, if they're in that cross cradle or cradle position, you're going to come in from underneath and make a U shape. But if you're feeding in a football position where baby is kind of tucked under and their lips are coming at your nipple horizontally, you're going to come in from the side and make a C shape with your breast tissue. So that's probably the biggest one. I've seen parents in trying to feed their baby in cradle or cross cradle, and instead of coming in from underneath, they come in from the side. And all that does is just make the area a lot bigger for baby to have to get their mouth around. So usually it's a simple fix when it comes to latches. Sometimes, of course, it can be more complicated, but I would say like 7 times out of 10, that's what it is.
So does baby ever give signs that the latch is good or bad? Or
yeah, they can. So really, when latch is perfect, a baby is going to stick their tongue out beyond their lower lips. They're going to cup the breast tissue like a taco, and then they're going to bring everything up to the juncture of their hard and soft palate. So if you stretch your tongue as far back as it goes in your mouth, it'll go from hard to soft. That's where they need to bring everything. And that's pretty far back in our mouths. So let's talk about best case scenario. So when baby is doing that and they're lifting the tongue up to the root, to that hard and soft palate juncture, they're actually creating a vacuum. So there is little to no air that baby is taking in. So for a breastfed baby not to burp necessarily after every breast or after every feeding, that's not necessarily a bad thing. It's definitely one of those things where I would watch that baby for discomfort. If you notice a lot of scrunching up their legs or kicking their legs a lot, yes, it could be gas. But for the most part, your baby may not burp a lot when they've been feeding at breast or chest. It's usually with bottle feeding that they'll take in more air. And that's just unfortunately the nature of bottles and the way that we use them.
So with bottles, you mentioned bottles, is that nipple confusion a real thing? Or
I like to call it nipple preference.
Okay,
so
I like that.
your baby is not confused. They know exactly what they want, and they are all about working smarter, not harder. So of course they're going to want the bottle. It's just going to drip and kind of flow into their mouth. So with bottle feeding, there is a way to feed a breastfed baby a bottle. It's called pace-to-bottle feeding, and it mimics the start and stop of milk flow at the breast. So a person's milk isn't constantly flowing once it starts to flow. It starts and it stops, and it's up to baby to kind of change the way that they're suckling in order to draw more milk out. So we're going to mimic that with a bottle. And so there's some great videos online. This is definitely something that, your lactation consultant, lactation support person, or even your doula may be able to teach you before baby comes or after they've arrived. But it's definitely something I go over if there's bottle feeding involved.
Okay, good to know. I had I'm learning so much. So lastly, there was a question specifically, and I'll read the question, but how early is it recommended to go past 3 hours between feeds at night, especially for a baby who has already reached her birth weight and is sleeping past the 3.5 hour mark? And I guess in alignment with that, I know you had mentioned some recommended ounces per day, like total. So what is that breakdown typically from, someone who is really early on newborn to someone who is maybe in that like 4, 5, 6 month range?
Yeah.
Talk
That's a
through
great
that a little
question.
bit.
So I would say in the early days, probably for the first at least 2 months of life, you can expect 8 to 10 feeds in 24 hours. And so that might just break down, if we're going by the 24-ounce number, just for simplicity's sake, it might be 2 to 3 ounces per feeding. But as your baby gets older, they're going to gradually start to sleep in longer stretches. I usually don't recommend implementing any kind of a schedule until baby is over 4 months. And the reason for that is, one, they're going to go through this huge developmental milestone at 4 months. And two, their feeding changes so frequently in those first 4 months of life that it's one of those things where you can feel like, okay, well, we finally got a rhythm down. We finally got this down. But then the following week, your baby is going through a developmental leap, and all of that hard work and scheduling that you've done is out the window. But to get to this parent's question, I would recommend probably not going past 3.5 hours until your baby's, I'd say, maybe 6 weeks old. And even then I give parents guidelines. I was like, we don't want you to go more than 5 hours. And this is more for the parent and breast health, really. And so we don't want to go longer than, say, 5 hours between breast stimulations. So even if your baby is sound asleep and they're sleeping great 6-7 hour chunks, you may still wake up because your breasts are feeling full, even though your baby's asleep. And again, this is one of those situations where you would use a hand pump or even manually express milk to comfort. We're not draining the breast fully, but we're just taking away enough so that you can fall back asleep.
So it has more to do on parent comfort and the regulation versus the baby's.
Yes and no. Sometimes too, I'll see parents read books about sleep training and they'll put their baby through sleep training and they're sleeping great stretches by the time they hit the 12 weeks. And it's like, okay, but biologically, babies are not supposed to do that. They're supposed to wake up at night. They're supposed to wake up at least once overnight. And then also, if that parent isn't getting up to stimulate their breasts, they're going to notice that milk supply drops. They're going to notice that their baby isn't quite as satisfied after nursing, or they're going to want to eat more frequently. And so I have definitely worked with those moms who are like, we did the sleep training program and now we're seeing this. And we brought the baby to the pediatrician for the 4-month visit and their weight's gone down. They've dropped their curve. So it's like, okay, well, let's talk about how you're feeding the baby. I hate to say this, but we might have to add a night pump or a night feed just to bring your supply back up. If that feels like too much, then if you're okay with giving formula, I'm okay with you giving your baby formula too, just to make sure that they get fed. And so I definitely have households where they're like, no, parents have very important high stress jobs and they need to sleep. And so they will usually start to introduce formula at that point. And then unfortunately, without that stimulation, yes, milk supply will go down. It could drop significantly. It could drop just a little bit. It's just so subjective based on the person.
Totally. And which is why working with someone like you to help with all of that
Exactly
works out so well. Well, thank you so much for answering these more specific questions. And thank you guys for submitting them, because I feel like we're able to touch on a lot more things than even we asked about in the longer episode. So thank you so much for joining us yet again.
Of course. Thank you for having me. This was great.
I'll leave again, I think we said a few links, and she had mentioned a few different resources and like trust-based, evidence-based resources. So I'll leave all of those links below, this one and probably the long one, just in case you guys like look at one or the other. So I'll leave all those below. But thank you guys so much for joining us for this episode of Wellness Fixes the Pod, and we'll see you guys again on the next one.